happens is you can't always find within the bankruptcy files who's really driving behind it. So sometimes the records will list lawyers who are involved in the debt collection activities, judgments, but not actually list the name of the hospital. I should also point out that lots of people take out second mortgages or third mortgages in order to pay the hospital, so the hospital is no longer involved because they were able to squeeze the family hard enough that they committed the money from somewhere else, and now the problem is they're going to lose their home because they can't pay the second mortgage or third mortgage. Same sort of thing with getting families to sign up to put these bills on credit cards or with other kinds of lenders. But even more importantly, for all the families who end up in bankruptcy because of aggressive hospital collections, there are more families. Some economists put the range at somewhere between 7 and 17 families. For every family that files bankruptcy, there are those 7 to 17 out there hanging on by their fingernails. Not filing for bankruptcy, but in the same kind of financial meltdown. The same kind of fear that they're going to lose their houses, their cars, the same kind of waking up in the middle of the night and wondering how it is they're going to pay the bills following a serious medical problem. Be very clear about who the families are who are forced into bankruptcy because of health care problems. It would be so much more comfortable to think that there's something wrong with those people, that these are people who weren't careful somehow or have just misbehaved or are trying to take advantage. We studied these families. These are hardworking, middle-class people, people who went to college, who got decent jobs, who got married, who bought homes, who had families. Those are the people who end up driven to bankruptcy when they can't pay their health care bills. And just to put the sharpest possible point on it, the people most likely to end up in bankruptcy in the aftermath of a serious medical problem are people with children at home. Families with children are nearly 3 times more likely to file for bankruptcy than are singles and couples who have no little ones. That's who's put at risk when hospitals use heavy-handed tactics to beat up on families who can't pay the bills following a medical crisis. It's important to remember that bankruptcy retains a powerful stigma in a world in which people will go on Oprah to talk about their marital problems and their trouble with their children. No one wants to stand up and declare publicly, I can't pay my bills. And yet, when people file for bankruptcy, it's public. It's not only in a public record, it's now there all over the internet. I get solicitations on this little pop-up ads on my computer. For $9.99, I can find out about my neighbors. I can find out what they paid for their house, and I can find out whether or not they have any drunk driving convictions. And right up there in the banner is that I can find out if they filed for bankruptcy. We can only estimate how many people are out there dealing with collection calls, dealing with threats to lose their homes, dealing with bills they know they don't have a chance of paying off. But they're simply too afraid to go to the bankruptcy court and declare publicly I'm a loser. I can't do this. And frankly, that's what aggressive debt collectors count on. People who are suffering from really heavy-handed debt collection from hospitals are not filing for bankruptcy. They're just getting squeezed and trying to cope each day as best they can. That's where the real problem is. If you're a nonprofit health provider and you know that someone can't pay, this is the time to jack up the bill. It permits the hospital then to claim that they didn't give away $100 worth of free care. Why, they gave away $300 worth of free care, $400 worth of free care, $500 worth of free care. Indeed, if they're clever, which hospitals can be, they managed to collect $100 from the poor guy who couldn't pay in full, and then claim, when they couldn't collect the other $400 for the procedure, that they get to write that part off as charity care. Talk about a win-win. They get paid in full for what they bill the insurance company for the procedure, and they get a bonus by being able to declare $400 worth of charity care. And that's the reason, of course, that they deserve that tax-exempt status, which means the rest of us are actually subsidizing the operation of the hospital. Three rules. If you're going to be a nonprofit hospital, you've got to give some charity care. Nobody really oversees your billing of the uninsured, but there is somebody there who's going to argue with you about how you bill the insured. So now we've got the perfect setup for a home run play. And the home run play is, don't charge the insurance company as much for the care that is provided to the insured patients. Charge the uninsured patients 5 times more than you charge the insured patients. Collect what you can from them, and then claim the rest of the amount that you didn't collect from the uninsured patients is charity care. Win, win, win. When a hospital overbills, someone they know is not likely to be able to pay, solely so that they can both squeeze them for as much payment as possible and maximize the claim for charity care that they have forgiven. That's predatory, plain and simple. The hospital is preying on that family, treating it like nothing more than one more opportunity to maximize revenues, maximize dollars flowing into the hospital. The family is nothing more than a piece of meat to that hospital, something to be feasted on, something to profit from, and a carcass to be left behind at the end. When a hospital owns an insurance company, then that means there is a lot of interest in maximizing collection from the people who have no insurance. The idea here is the two powerful players, that is the hospital and the insurance company, team up to make sure that their costs jointly are as low as possible, and that the uninsured bear at least as much as they can possibly shift over to them for the cost of operations. When hospitals own insurance companies, in effect, there's always the possibility for really nice sweetheart deals. The hospital agrees to a big discount for the insurance company in terms of what it will pay for blood tests or throat swabs or access to the operating room or the emergency room. But woe be to the person who walks in who isn't covered by insurance. For that person, it's now time for full freight so that we have this irony that the people, frankly, who have more money and some health insurance coverage, they or their insurers are actually billed less and pay less than do the uninsured who, by and large, are uninsured because they can't afford health insurance. So this is using the healthcare system to assure that it may not help the rich get richer, but it sure helps the poor get poorer. Money, money, money. It's all about how to bring in more money, in this case, not to pay it out to shareholders, but to grow an empire, to make it bigger. It's better to be running a big, big, big hospital than just to be running a big hospital. It's possible because of our tax-exempt structure for these hospitals to maximize revenues, minimize charitable care, and then take that difference and reinvest in becoming an ever bigger and ever more powerful institution. You know, at some point then what happens is the institution almost takes on a life of its own. It becomes entirely self-protective. The legislature protects the hospital. It hires advertising to make sure that the press is quiet and non-critical. The institution is no longer there to serve the people. It's there to serve itself. America's been following market-based solutions for more than 100 years. The first one is level the playing field. If someone wants to dominate a market, then make them pay taxes. That way, at least, the playing field's level, and anyone else who comes in who will have to pay taxes would be competing on even ground. The second is that we learned the lesson back in the late 1800s that monopolies are not good for markets and not good for Americans generally. And Teddy Roosevelt made his name as a trust buster. We have antitrust laws. The question is whether or not those antitrust laws are being vigorously enough enforced by our own elected officials to go out there and examine what's happening in marketplaces, including healthcare marketplaces, to make sure there isn't a bully boy that dominates a particular market. And if there is, the laws are in place. We don't need new laws here. We just need enforcement of the laws to break up that monopoly, to say no. In the same way that we said we weren't going to let railroads have monopolies, we weren't going to let particular trucking companies have monopolies, we're not going to have that sort of thing. This is America in many ways at its most vulnerable. America in a position where it's hardest to think about shopping for prices, where the consequences of anything less than the best possible care can mean the death of someone you love. It's at that moment that we most need to be careful that there is an active, aggressive healthcare market with plenty of healthcare providers who want over and over to keep raising the standard of care, raising the healthcare services available to the people who need them. Here, more than any place else in our economy, we need to make sure that our elected officials are enforcing the laws that exist to protect the rest of us. If not here, then where? Isn't that it? The monopolist hospital also is very effective at disciplining doctors and making certain that the doctor acts for the benefit of the hospital rather than for the benefit of the patient. So to take the example, if the doctor thinks that the patient should be able to get in to see a specialist the very next day and that's what's medically best for the patient, and the hospital system has decided that, well, if we slow that up by 30 days, there'll be some number of people who'll give up, who'll go away, who may even die, and never need that more expensive patient care. That means the doctor is now going to have to make a choice. The doctor can speak out on behalf of the patient. Indeed, if it happens often enough, can speak out about the practices that injure many of the patients for this doctor. But if the doctor does that, the hospital, the monopoly hospital, has the opportunity to say to the doctor, in effect, you're not going to practice medicine in this town again. You either play by my rules or you don't play at all around here. I think there are a lot of doctors who are very good people, who went into medicine because they want to help people, who are there to be advocates on behalf of their patients, but who realize a cold reality at the end of the day. And that reality is that if they get frozen out of this hospital, they won't be there for any of those patients. All those long-established patient relationships, they'll just be gone. And so the doctor's left, the doctor's forced to make compromises, advocate for patient care, try to do it, as it's euphemistically called, within the system, try to find a place where for a particular patient you can pull a string, you can get something moved up. It makes the doctor's job harder, not only in the sense of having to fight a bureaucracy, but harder in the sense of what it means to your heart. When you're there for your patients, and yet you know that you got to keep treatment on the road that's been built by the monopoly hospital that demands that that road be organized, not for the benefit of the patient, but for the benefit of the hospital. Doctors are put in an impossible position under those circumstances. Bless their hearts, they do their best on this. But that's where they're caught. A monopoly multiplies every other problem in the system because it takes away the discipline that comes from a free market. If one hospital gets known for jacking up prices, for squeezing everyone who can't pay, for demanding payment in advance, no matter what the circumstances, then people start using other hospitals. The market works. That's the notion behind the American ideal. But when a hospital dominates an area, and when people are talking about their health, when it's that scary moment, when you've got chest pains, when it's that instant when you're looking down at a baby whose cheeks are flushed red and whose eyes are glassy, you need that hospital care. You need it, and you need it right now. And price is not at the top of the list. Whether or not they're going to squeeze you later for payment or demand your house or demand part of your wages, demand a pound of your flesh in the future is not what's on a family's mind. What's on a family's mind is help me get the care I need for the person I love. A hospital that has a monopoly position takes advantage of that fear. It takes advantage of that desperate desire to take care of the people you love. It takes advantage of it for nothing more than plain old money. You know, it's ironic that most of the people who argue that healthcare is different and that the market doesn't work here are arguing against consumers who have too many choices, who have their own savings account, who have a little of their own skin in the game, so to speak, on the financial side as well. They are not arguing markets don't work as a way to try to support monopolies and to try to give a single provider the ability to determine all of the financial consequences of a hospital stay. This is a place where if there's only one hospital, how can anyone test whether the prices are right, whether the collection procedures are fair, frankly, whether even the level of service is what ought to be provided by a hospital in the 21st century? If there are no benchmarks, if there are no other hospitals serving that same community, saying, we can do it better, we can do it cheaper, we can do it and offer some free care to those among us who can't pay for these hospital services. If none of that exists, then you've got a bully boy on the block. Literally, the one who determines it all, the level of service, the prices, and how hard they're going to hurt people who can't pay. That's what monopolies accomplish, and that's where the market has broken down. That's not the American way. That's the way of the bully, the dictator, the one who wants to control it all. In most communities, the nonprofit hospital is in effect the bit player. It's the for-profit hospitals that are jockeying to provide care and to get out there with some advertising and some new promotionals and be at the cutting edge of the new technology and bring in patients. And that it's the not-for-profit hospital that's there in effect to add the comfort to the market, to make sure that those who can't pay will still have a place to receive quality medical care. It's the world turned upside down when the nonprofit hospital becomes the bully boy dominant player, because the nonprofit hospital has been given the advantage of not paying taxes. And that means when it's the bit player picking up most of the charity care that has been refused by the for-profit players, that's fine to have that tax benefit. But when the bully boy has the tax benefit, it keeps all of the other hospitals squeezed out. If I ran a for-profit hospital, the last market I would want to go into was a place that already had a dominant nonprofit player. It would be like going into a market where I would be trying to compete with someone, only I'm going to have my right arm tied behind my back because I'm going to keep losing revenues in taxes. I'm going to have to keep paying those taxes over and over, and I'm fighting someone who gets to punch with both fists. That's not a very attractive market. And of course, that means the bully boy gets to stay in the bully boy's position. in control of everything. Back to the consequence of monopoly. That monopoly is not only about restricting choices about where patients can go because there's no place else to go. It's also about restricting who's going to be there to provide that care when the patient gets sick. So the monopoly hospital can decide that it doesn't want to bring in the fancier doctors who may have the more expensive procedures and would raise the standard of care, raise the level that all doctors have to meet or be charged with malpractice, or simply raise the costs. Doctors who may come in and say, rather than, gee, there's nothing we can do, there is something we can do, but it's going to cost a lot of money, and that's going to cost the system money. So it's the ability to tell the patients, you have to come to us, and then make the decision internally what constitutes us in a way that isn't oriented solely toward what's the best possible patient care, but is oriented toward what's best financially for the institution. What leaves us spending the least money to provide the care that we are legally required to provide. And that's important to remember. 99.9% of the people who work for a hospital can be good people who are there to give care. And that's the only reason they're there. But we're talking about an organizational structure. The nurse who sits with you through the night. The good people who are there to make sure the hospital operates to give the best care possible to the people who are sick and who are injured who come in are not the ones who make the corporate decisions to hire lobbyists, to spread around advertising in a way to minimize criticism of the hospital, or, most importantly here, to go after the very patients they work so hard to help get them back on their feet, to try to help them survive a medical crisis, only to get out and be hounded by professional debt collectors to take away what little bit of financial security they might have, to take away their homes, to take away what they might have built up in a little savings, to take all that away from them in order to pay for their medical care. It's a real disconnect. You're going to have thousands, literally thousands, of good people aimed toward caring for sick people, and yet the overall structure can be one that guarantees that although the patients who come to this hospital may recover physically from their illnesses or accidents, they may never recover their lives financially. Anyone who believes that the charity concept is nothing more than a business model truly does not understand what charity is about. And somehow, at the heart of this enterprise, thinks that providing health care is just like making so much soap or so many cars. It's not. It's about how to alleviate suffering, how to help babies live that might have died, how to help the elderly make the passage when the time has come. And most of the people who affiliate themselves with hospitals, who go to work at hospitals providing nursing care and physician services, and who mop the floor and who work in the cafeterias, are there because they understand it is different work. If they'd wanted to work on a factory line or they'd wanted to be in the business of selling stock futures, they could have gone off and made more money elsewhere. They could have done other things with their times and talents. They came to work at a hospital because they understood that it was different, that it was as much a calling as it is a business. When the person in charge doesn't understand that, it directs the whole enterprise in the wrong way. It moves it away from what makes a hospital special and what gives us our special trust in a hospital, and makes it selling soap, selling cars. I don't want to do that with my health, and I don't want to do that with the health of my babies. Charity is what we agree to collectively. We give the hospital the chance to take care of our most desperate moments and our most hopeful moments, when people are dying, when people are being born, because we trust them with that care. And we ask that they do that first, last, and in between, with all of us in mind. Charity is just woven through that. It's about giving the best possible care to everyone, not just to the people who can't pay, but to everyone. It's about being centered on the patients and the families of their patients, not on business models scratched out on blackboards and pieces of paper and profit and loss statements somewhere else. It's about why we let them run hospitals at all and don't demand that they get out of the way and put someone else in charge of that hospital. One measure of a man is what he does when he has power. Does he use power on behalf of making the lives of others better, safer, stronger? Or does he use power in order to create more power for himself? Hospitals are powerful institutions, and those who run them sit in a position where they determine all of the structures that are in place that will determine whether or not caregivers can give the care that's needed, can do their best, can save lives and reduce suffering. Whether they use their power in that direction or back toward themselves is one of the true measures of who they are. It's not about how dare you. It's about, let's just look at the facts. Are you charging people without health insurance more than you're charging people who do have health insurance? Are you telling families that following a medical crisis, you'll come and take their homes away if they can't pay? Are you telling families that you'll organize your business in a way that if they get sick a second time, they won't come to your hospital and run up more free care just because, heaven forbid, they need it? Boy, we're exactly right to ask the question of how dare you? Only the how dare you should be a million voices who are the public to be served, saying to the officials of the hospital, how dare you follow practices that put our health and our lives and the health and lives of our children at stake so that you can build a bigger empire? How dare you?